Okay, hello. My name is Alan Friesen. I am the evangelist for the Caring Employers Healthy Teams Collaborative. And with me is my team member, Scott, with the Innovation and Community Wellness Division of the CEHT. So I had a chat the other day with Barry, and it reminded me of such a great story, a positive story. So I wanted to share it with you. Throughout my career with employee benefits, I've probably been involved with, I'm going to say, about 30 times where we had a critical illness claim. And a critical illness claim means that you've been diagnosed with a life-threatening condition. You're likely not to survive it, but with the help of the critical illness dollars, maybe you got a better chance. So you get a chunk of money. You use that money for whatever's appropriate for you. It's not to replace your earnings or anything. It's just a chunk of money because you've been diagnosed with this life-threatening condition. So he is alive today, and I helped him get paid out on his critical illness claim in 2014. So super exciting thing. So basically he had,
Way to go, Barry.
yeah, way to go, Barry. Exactly. So he had, it's called chronic myelogenous leukemia, and it's a disease which the bone marrow makes too many white blood cells. So it's a serious life-threatening condition. And at that time, we processed his claim, paid him out $50,000. And then some people will use that to go somewhere in the world to get medical attention, that kind of a thing. In his case, he was fortunate enough that the medication that they put him on did the job, a dasacinum, I think is how you pronounce it. And he was on that drug for 8 years, and then now has weaned off that drug and is just going checking in every once in a while to confirm that he's all clear, he's all good. So 2014 paid out $50,000 because the insurance company's assessment was he wasn't going to live that much longer. And here he is in 2023, and he's doing well, and he's not even on any of the drugs. So the point is, I guess, that critical illness, it's sometimes it's just something that's going to benefit your financial health, even if it didn't contribute to your physical health. But there is a potential that also was a value to him in a very stressful time when he was experiencing a failure of health. You know something about that, don't you, Scott?
Yeah, firsthand I do. I spent 3 months in induced coma in a critical care ward. So yeah, I've been there. But I was really inspired when you told me about Barry's story, and yeah, it really, it's really emotional. I think that knowing what a family goes through, and unfortunately, I, like most people, and the number is 1 in 5 North Americans will either directly experience, or a loved one or a close friend will be diagnosed with a critical illness. It's that high in modern terms. So it's something that many of us will have to face or have faced. And I started looking into it, and critical illness insurance was actually, it's not that old. It's a product of 19 something, 80s, 70s, by a doctor, a heart doctor, right?
Yeah. Yeah.
And he realized that people were living longer and surviving, but the treatment was very expensive. The article I read said he was in Africa, I think, or in a country where you probably know more about the story than I do.
I know that much, is that he was a doctor in Africa, brilliant surgeon who was one of the first to do heart transplants. But then he said, okay, great. So somebody can get a heart transplant. Nobody can afford a heart transplant, right? And that kind of led to critical illness being a thing, so that for when you need very expensive interventions to keep you alive, that you had a pot of money to assist you in that circumstance. And on an individual basis, critical illness coverage is very expensive and hard to get. But on a group basis, critical illness is extremely good value. So I'm a big fan of critical illness on our group plans.
One of the articles I was reading said that people had to be careful not to confuse
disability income.
Yeah, right. Disability benefits with critical illness benefits. Can you explain that to me a little bit? For those of you who don't know, I'm not an insurer. I'm a support person that works with my team to help research and share opportunities for wellness and increased health with the members of CHT. So when I have a question about insurance, I talk to my man, Alan. If he doesn't know, I don't know who does.
Well, Scott, it also, assists our new clients in setting up direct bill access for with their providers, whoever they go, as a dentist, a pharmacist, a chiropractor, that we are encouraging those providers to set up direct billing for the clients that are coming into the Caring Employers Healthy Teams, to make this as seamless and smooth a transition. And then the other party sharing is about where, we want to encourage health and wellness in our team members of our clients as well, and that's some of the messaging that we're working on. But back to your question, Scott.
Okay, I'm interested to know, because I don't.
Disability income coverage is what replaces your earnings if you can't work. Okay, that's what it does. So you have to be able to prove that you're unable to do your work, and then you buy a significant thing like 60% that you can't do, kind of a thing, and then that provides an income replacement. Generally, it's based on 2/3 of your pre-disability earnings, and most of the time the contracts have a contract cap that says no more than 85% of the pre-disability net earnings, which at 85% of pre-disability net, that's a pretty good income replacement. If you wouldn't have to worry about money if you were in that situation. Critical illness, entirely different in that all it is based on is diagnosis. So if you have, and the critical illness contracts vary quite a bit, but basically, if it's one of the listed conditions, it just pays you out a flat amount of money. And that could be 10,000 or 25,000 or 50,000, 100,000. Most of the time on group contracts, they're 25 or 50. But you could still be able to work, which was actually Barry's situation. Barry took a little bit of time to have some treatments and get, things sorted out with his doctor and his medicine. And then after that, he continued to work. And so he didn't suffer a loss in income. And the critical illness isn't to replace income anyways. It can be, but that's not the purpose. The purpose is just that you get a flat amount of money, you use it for whatever's important in your circumstance. So, some people will use it to access specialized medical care in a different country that specializes in that, right? Like, let's say Oslo, Norway has the
Right.
best CML treatment in the world. Okay, well, I got some money to help me get that done. Or they might modify their home or business to accommodate their new reality, right? Or they might just say, I'm not going to be around much longer. I'm going to start scratching some things off the bucket list and take the family on a cruise, or, do whatever, that kind of a thing. So it's quite different in how it is structured. But it's really, really clear that so long as you meet the diagnosis, the claim gets paid. I can tell you that all of the other critical illness claims that I've helped people get before, I don't think anybody lasted more than a year before they passed on, and then it became a death claim, right? So that's the traditional thing. Barry's the exception. Yay, Barry, good job.
But that's changing, and this is what I found amazing, because of course they said I was going to die a few times, and I didn't.
Right.
You told me Barry's story. Both my aunt and uncle were told they were going to pass away in a very short time due to cancer. They're both still alive and traveling. And I thought, boy, am I just, lucky to know people that have survived. So I went looking, and they did a 5-year survey in Finland. And it was a big 17 hospitals, 13 ICUs, 5 tertiary care centers that specialized in critical care. And 5 years after treatment, 66.7% of the patients were alive.
That's pretty impressive.
And I was surprised, but that's recently, right? Like, it's the advances in medicine have changed. This study was done last year, the year before last. So not exactly sure. But the point is that more and more people are surviving longer after a critical illness diagnosis.
Yes.
And I got looking into, some of the views of doctors and caregivers. And one of the things that they said is that when people are diagnosed, of course, the first shock they have is, I'm going to die. And then the next shock is, how do I take care of my loved ones? But then very quickly, stress starts to occur about, how am I going to pay for this? How, there is treatment, maybe like you said, somewhere else. I was out of country when I got sick, and it was costing, it averaged out to about $12,000 to $15,000 a day. And there was days where it was up to $25,000 for that day for the tests they were doing. Now, this was in Japan, and they have a slightly different system than we have here, and I had a bunch of insurance at that time that took care of it. But the situation is that often when people are diagnosed, the stress is incredible, and we've so, you know, the statistics show that 66.7 people who are diagnosed are alive 5 years after. As you said, you know, you who've dealt with many people in this situation, that's, you know, the statistic is high, but the reality is a lot of people do terminate during that period. But they go through a lot of stress and quality of life. And a lot of the doctors reported that their patients' quality of life, worrying over, can we pay, you know, can I pay for my funeral expenses? Can I, you know, put enough money away that my children can go to university? So much so, and this is a really, this alone for me as a father makes me want to make sure that I have critical illness in place, is that 51.2% of people diagnosed with critical illness develop post-traumatic stress syndrome immediately while they're trying to deal with the terminal illness. And
well, if I can interject one thing, Scott, do you remember Gary, the gentleman I helped earlier this year who was getting shortchanged? Yeah. So Gary,
the one you stood up for,
yes,
yes,
yes, the one that kind of officially launched the Caring Employers Healthy Teams Collaborative, actually. So, but with Gary's situation, he was contacting me, and he was battling cancer and really worried about that. But then secondly, he said, I think I'm going to lose my house. Like, I'm really worried because there's no way this income replacement is allowing me to pay my bills, right? So if you can imagine, you know, every month you're relying on savings because you're not getting enough monies in, kind of a thing. So it was, I could see the stress related to not only the health condition, but now all the money things associated with that, right? So, yeah.
Yeah, it's from all of the stuff that I looked at, it's very clear that for the small cost of the critical insurance, and I want to come back to what you talked about in a group, because for me, because I've been in that situation, I'm recovering long term. There was a time when I wouldn't have passed the medical test, right? And so, but there is an opportunity in CHT where you could. Can you explain that?
Yeah, you betcha. For individual contracts, they're always medically underwritten, and medically underwritten, like, so you wouldn't qualify. I probably wouldn't qualify because they'd say, oh, you've been to a chiropractor before. Well, no, we're not going to give you this benefit, right? The medical underwriting is super.
You ride a motorcycle, you around horses.
Exactly. Yeah. Oh, you smoked a joint last summer. Pooh, you're out of here. So anyways, they're really stringent on the medical underwriting. But the advantage of being on a group basis is that there's a non-evidence limit. So if you have a $50,000 maximum on your critical illness, you likely will have a $50,000 non-evidence limit depending on your group size.
Wow.
What our partners have done has given us higher non-evidence limits, which means people that could otherwise not qualify are going to get the coverage, no medical questions asked, right? Another side thing that I don't know if you're aware of this, but a lot of times too on the group contracts, if somebody is diagnosed, even if you don't have critical illness, but you have life insurance, and somebody is diagnosed with a severe medical condition, a lot of insurers will advance half the amount of the life insurance proceeds. So, you know, you have 100,000 life insurance, you get diagnosed with this critical cancer kind of a thing, or a terminal cancer, and then they will advance 50,000 of it. I have one gentleman in Medicine Hat that they advanced him to his 50% 2 years ago, and he's still living. And I just like, woo, good for him. I hope he can keep that going right like to 65. That'd be amazing. So, yeah.
But that solution is one of the reasons that we created CHT, and we're so passionate about it, right? Because the insurance companies are not going to say, hey, we want to really help you out and give you some money here. Our partners might, because you selected them very carefully. But part of what we do is make sure that we're in contact with the members of the CHT collective. And if there's a way we can help them out, like letting them know that they should, or we do it on their behalf, check into whether they could get an advance on their life insurance. That's an important part of what we do, is we're looking out for the people on the team. So, and when, everything I read, It really comes down to how many people are supporting you, because it's even though it's a critical life, possibly ending situation, you have to try and get through it, and some people do, whatever the statistic is. So I think that not only is it's not incredibly expensive to add that to our group plans, is it?
Well, one thing, interesting side point with it's not very expensive, but one of our partners, cooperators, their critical illness product is substantially broader than a lot of the insurer products, right?
Wow.
And so if you compare, as an example, some of the clients that are coming to CHA, to Caring Employers Healthy Teams, are coming to us from Alberta Blue Cross. Well, if you compare the Alberta Blue Cross critical illness to the cooperator's critical illness, the cooperator's critical illness has way more conditions, right? It's way more liberal. And it's also, even in terms of the specifics around a heart attack, as an example, there's 4 different classifications for heart attacks, right? And then so the Blue Cross contract will only pay for a class 4 heart attack, so the most severe, right? A lot of muscle damage, that kind of heart muscle damage, etc. But others will pay for a 3 or a 2, right? Which are way less severe heart attacks, but you still had a heart attack. I mean, you still have a medical problem, a challenge that way, but they will pay. Whereas the other ones, it has to be way more severe kind of a thing. So I'm really pleased with how broad their critical illness contract. It just allows us to be of more value for people experiencing a failure of health, to say, this one is one of the conditions. We're going to get you this, get this paid out for you. So
interesting you should say that, because when I was looking through the research, heart attack and related things was one of the highest survived critical illness. And it's also very common in people that are in business. So I would think that our clients who tend to be in business, or large nonprofit organizations, or small or medium, that can join in the collective, that would be a great benefit to them, because the costs are high to get repaired, right, or get treatment.
Hey, I got to share you one more thing. I think you'll love this. We have a client that came to us, and the plan that they were on, there's 3 people in the group. One is 72, one is 66, and one is like 40. So they had $25,000 life insurance under the previous group plan. So the one who was 40 years old had $25,000 life insurance. The one who was 66 got kicked off, doesn't have any life insurance. The one that's 72 got kicked off, doesn't have any life insurance. So now when we bring them over to the Caring Employers Healthy Teams, hallelujah, we also agreed to up their coverage. So the one who's 40 now has $150,000. She didn't have to fill out a medical form. She just got the coverage. The one who's 66 has $75,000. Didn't have to fill out a medical form, has the coverage. The one who's 72 has $37,500 life insurance. So from 0 to 37.5, 0 to 62.5, no, 75,000, pardon me. So they were able to get this coverage without having to prove they're in good health. And I know that in both cases, they wouldn't have qualified. But because of the non-evidence limits that we've got negotiated for our clients with the Caring Employers Healthy Teams, we could get them life insurance again. So hallelujah.
Well, and it's nothing sneaky, right? Our insurers fully understand this, and they're happy about it. It's not like, we're pulling some fast one there.
Nope.
Would you say, though, like I know that survival rates have gone up and our life expectancy has gone up considerably over the last few decades. Would you say that some insurers have failed to keep up with the changes in health and medicine and survivability?
That is a good way to state it. Like, I mean, there's yes, definitely, they're not kind of keeping up and not being current with how things are actually progressing, even in terms of adding in benefits that are like necessary today that probably weren't like 5 years ago and 10 years ago, right?
We have a great thing on MRIs, right?
Yeah, I was just going to bring up the same one. Exactly. Sure. There's a good situation, right? If probably 10 years ago, there was very, very little MRI use. Now it's a common diagnostic tool, right? But we don't have many of them in our system. So then you have long waits. So if I'm on my shoulders blown out and I got an 8-month wait to get an MRI to determine how I'm going to get medical assistance to help my shoulder. So 8 months, I live in pain, right? Well, so then instead with our Caring Employers Healthy Team Collaborative, We have private MRI coverage. You go down to UT3 tomorrow, pay for an MRR, get it covered through that program, and then you got the data you need so that you can move forward and get treatment and get the type of intervention that's going to help you recover your health, right?
Well, and that's a great point. It's part of what we're building through what I do. And that's so our members, we can direct them to services and providers right here in the community, or alternatives to those long waits that we're all experiencing in the regular system. So that's another great tool. I love working in my department because we get to help people in that way. So I'm excited about that. So that's a great story about Barry. Thanks for sharing that, Alan.
Yes, I asked him if he wanted to be interviewed. He said, "Oh no," I said, "All right," but he was totally fine that I shared his story. So yes,
so fantastic, great.
Yes.
So if people,
go ahead.
So I was just going to say, if people want to learn more, they can call you anytime, or they can email you.
Yes. You know what? Let me find my little thing that's got my. Is this the one?
There it is.
Yeah. Oh, had it, lost it. There it is. Yeah. So here's our email address. Here's our phone. There's my cell phone number, but my team at alanfriesen.com. It could be myself. It could be Scott. It could be Sherry. It could be Kelvin who responds. But give us an email. Doesn't even have to. You don't have to be a client. If we're told you something and you want to know more, give us a call or send us an email. We will gladly help you.
Yeah. There's two really cool things about that. So my team at alanfriesen.com, all of us see it. And so we can all add input into it, or say, hey, this is something that I think Alan needs to have a look at. He's got expertise in this. Or it may come to me and say, hey, is there a provider in our community that will work for this? But we're the only company I know that the phone number that we publicize is the boss. That's such a cool thing. So anyone, like you said, a member of our program, a member of the CHT, or somebody out in the community is confused about their benefits, or concerned that maybe their provider isn't keeping up with the changes or the reality we live in now, can give you a call or send fire off an email to my team, and we're there to help.
That's why we exist, is to help you. So if there's any value we can provide for you, please do reach out to us. Thank you much. Keep yourself well.
Thanks very much, Al.
Thanks. Gitamatsan to all my Indigenous brothers and sisters. See ya.